Hi everyone and welcome to another episode of Ask Your Doctors. I'm Dr. Randy Lamfel and I'm everyone's favorite obstetrician and gynecologist in training. I'm standing in for Dr. K today. As we know, we're approaching Fibroid Awareness Month, so we thought we'd sit together and have a little grill chat while Dr. K takes some notes from us. I'm joined in studio today by two incredible women who are doing incredible things, and they just happen to share the same name. They both go by the name of Keabetswe, and they're going to help me today to unpack the topic of fibroids, find out what fibroids are about, and what you can do if you are affected by fibroids. Ladies, welcome to the show.
Hi, so much. Thank you.
How are you this morning?
We well. I'm well.
Very, very well, thank you.
Absolutely amazing. So we'll start with you, Keabetswe. Can you just introduce yourself, tell us a little bit more about yourself, and tell us about your journey with uterine fibroids?
My name is Keabetswe Nguza. I can take you through my journey. My journey started in 2011 when I tried to start my journey to motherhood, and I found out that I have fibroids in my uterus. And through that, I went to a gynecologist, and I found out that I've got 16 fibroids, and I cannot have kids until I have a procedure called myomectomy. I went through that, and 4 months later I fell pregnant and I have a beautiful baby boy.
Wow, congratulations.
And thank you so much. He's 9 years old now. But in 2016, when I was trying to go through my journey again of motherhood, I found out that the fibroids are back, they've gone back, and that's something that mostly you were not told. You think that you go through this procedure once, and
that's it, and the fibroids are gone.
Fibroids
so
are
you've said a mouthful, Keabetswe. I want you to just take us a little bit back. What symptoms did you have? What made you think, oh my word, I need to go and see a doctor? Take us through that procedure, and when you saw the doctor, how did that interaction go? How did you feel? How did you agree to doing the surgery, etc.?
The symptoms I had, it was pain during intercourse, excessive bleeding, and I always wondered why I had excessive bleeding, but only then I found out, I think in 2010, I went to a gynecologist and he told me that I've got fibroids growing, and I was not really interested in having a child then. Then in 2011, after 4 months, he just said the fibroids are little, no, it's fine, you can continue. Just after 5 months, these fibroids have grown enormously, and I found out that I have to go through myomectomy, and that's when I had a conversation with my doctor. He says that's the only way, we can't do any other procedure. You have to go through a myomectomy.
Very interesting.
So it was pain during sex, excessive bleeding, and sometimes I wouldn't go to work because my periods were just too much.
I can imagine. Keabetswe, can you tell us a little bit? I think your story is a little bit different. Can you just share with the viewers what you had to go through?
Yes, my name is Gynaecologist Modimogale. My journey, is a bit different from my friend here, Keabetswe. For me, it has been the excessive bleeding that I had experienced over the years. And with, many consultations with regard to gynae and stuff, what came out of it was the hormonal imbalance that was what it was reduced to. And so put on certain contraceptive to try and regulate that. But even to this day, it's still continuously something that I am fighting, to get it resolved, because it normalizes, then it goes up normal again. So this has really been my journey over the years.
So you don't have fibroids, you have not been diagnosed with fibroids, but you have abnormal uterine bleeding, so kind of similar symptoms to people who have fibroids.
Absolutely, yes.
Sure, so interesting to hear. I'm sure there's some viewers who are listening and thinking, what are fibroids? What are these people going on about? Keabetswe, do you just want to tell them a little bit about what are fibroids and what are the symptoms that normally come with having fibroids?
Okay, fibroids are non-cancerous tumors which are in your uterus, or they can actually also be outside the uterus. The symptoms are usually excessive bleeding, pain during sex, Yeah, I think so. Well, that's my symptoms. I don't know if you, doctor, can give more of the symptoms.
No, absolutely. I agree with you. And the most important thing with fibroids is the location of the fibroid.
Yes.
So we basically describe it in terms of where the fibroid is. So it can be intramural, which is inside the wall of the uterus, or it can be subserosal or submucosal, so almost on top of the uterus, or inside the uterus facing the cavity of the uterus. And the symptoms that you mentioned are basically the symptoms that people go through, including pelvic pain, masses in the abdomen. So these fibroids can be like as small as a little pea, or they can be massive. You can look like you're carrying a full-term pregnancy. So that's how hectic basically fibroids can be. Can you just tell us a little bit more about your organization that you've started, how you started it, what was the leading factor behind you starting this organization?
I think after my second procedure, because I found out that I had a cesarean, I had a myomectomy, and I couldn't have a myomectomy again because I'd be cut again the third time, and I wanted a chance to have another baby. And I went through a procedure called uterine fibroid embolization. But after the procedure, what I found is that, emotionally, it is very draining. You need people who've been through what you're going through, and yes, you can speak to your doctor, but your doctor only helps you in terms of physical, but not mental or experience. And I just went through the internet. I'm like, I'm sure there's a Fibroids Foundation in South Africa. I search, and I'm like, there's nothing. And then I search, and I find one in America, and I start having a conversation with the lady. And I was like, there isn't one in South Africa. And she's like, start one in South Africa. And that's where my motivation started building from there. Came up with the vision, came up with the mission, registered it. And one of our key objectives is awareness, advocacy, speaking to women, going out there to raise awareness about fibroids. Because a lot of women actually suffer in silence. In workplaces, people don't talk about it. But you'd find that majority of people have gone through it, but they don't talk about it. So we want to break the silence of fibroids. We want to raise awareness about fibroids. We want to advocate for fibroids as well.
Absolutely. I love what she said there. She's speaking about looking for something, finding the gap that exists, and then you see that there's a gap, and then you stand in the gap.
Yeah.
That's so amazing, and that's why I think you ladies are really leading from the front, I just want to find out, with this organization, can you tell us the name of your organization? And then tell us, how do medical doctors like me pour into this organization, and how do you pour into us? And how does somebody suffering with fibroids pour into you, and how do you pour into them? What is the relationship between those groups?
The organization is called Fibroid Awareness Association of South Africa. How doctors, I've had doctors, we had a launch in 2018, and there are numerous of doctors who want to help women out there, So I've been working with quite a numerous of doctors like Dr. Tubisi, Dr. Badi. What they do is they find that women that they do the procedure for are mentally exhausted. So this is where FASA comes in. So FASA will be able to pour in with the doctor, where the doctor will say, yeah, please can you help her with psychological or emotional or any intervention, After going through the procedure, the doctor leaves you after a week. If you've done myomectomy, the doctor gives you medication, go home and heal. But after 2 weeks, you're still in pain, you still can't do things, and that is what FASA is here for, to guide you through the procedures, to say you have 6 weeks. The first week you'll be going through this, the second week you'll be going through this, so we are here to help you through those steps. If it's uterine fibroid embolization, we'll tell you what to also expect, and that's what we want our doctors to work with us, to say, we are not leaving you here as in dumping you after the hospital, but there is a foundation that can help you through it. And also what we also want to pour in with the doctors is to raise the awareness and also be involved with the doctors to say that women out there are not talking. FASA is here. Let's talk about it. Let's talk about it, you know.
What I hear you saying is that because this is such a huge problem for women, is that we need a multidisciplinary team helping these women along the way. So you feel almost like once the doctor is done dealing with the medical problem, you have all these emotional and psychological problems that are persisting, and you need somebody to sort of step in the gap.
Yes.
So that's where FASA comes in. So as the doctor, I can contact FASA to deal with my patients who are going through dealing with fibroids, and then you guys can help them with that emotional and psychological journey. That makes sense. That's absolutely amazing. And I think it's true. Sometimes in medicine, we just deal with the clinical part, and we forget that you're dealing with this human who's psychological, who's social, who needs to go back into their workspace, who needs to go back into their home, and who needs to reintegrate into society. So that's absolutely amazing. Again, you're filling another gap. You ladies are really doing the things, hey? Absolutely incredible. Kia, can you tell us about your role in the organization and what you do and how you help the organization to move forward?
So I joined the organization when Keabetswe reached out. I mean, her and I have a history of friendship for many, many years, over a decade. And so then, you know, we've always known each other. However, then she requested me to join based on the expertise that I have. And she said, no, I'll definitely be of value to be added in this organization. And also, because also there's many different women also that I interact with also, it was that she thought, you know, would be suitable so that we can club in and just move this thing forward and actually help to just empower ladies as well in FASA.
Ladies, we have a number of questions that we received from our viewers on social media that we just need to go through and help them understand what it is that they're experiencing in their lives at the moment. So the first question from one of our viewers is they say that they crave sand, soil, clay, and ice towards their period. What is wrong with me? Is there something wrong with me? What would you guys say to this person?
I'm not a doctor, but it looks like an iron deficiency. Before your periods, things go haywire. So yeah, it is an iron deficiency. I have the same thing as well. Well, I don't crave soil, but I get low blood pressure, and I suffer from hormonals, where my sexual hormones are a bit high. And so that one is definitely an iron deficiency.
Absolutely, I agree with you guys. So it's actually a condition called pica. So this is hilarious because I actually used to suffer from pica as well. I used to eat paper. So I would literally like tear paper up, chew it and swallow it. And it's basically this nutrient deficiency that you have where you start craving non-nutritious types of food. There's a whole host of food that you can crave during that period. So I completely agree with you. It's an iron deficiency anemia. And how you get it is if you bleed excessively, then you end up with that anemia. And this ties in with what our second viewer asked us, because she said that she bleeds excessively. She says that her periods are almost a traumatic experience for her. Yeah. And she asked, what advice would you guys give her on how to cope with this bleeding? I think, Kia, you can take the question.
Yes, seeing that has been my struggle for the longest time. But yes, obviously it's important to seek medical help to obviously find ways in terms of combating and how they can assist. But yeah, the excessive bleeding is something which impacts the anemia, low blood at the end of the day. And that's also something that I've also suffered from. And that's something I've known that I have to, of course, be on iron supplementation all the time. Otherwise, it's the dizzy spells, it's this, that comes, with it. But yes, it is important to seek medical help, but however, it is changing your tampon or thing regularly, or your pad regularly. For some, it's literally like in an hour, you can have like 2 pads that you change, which is quite excessive. But seeking medical help is first prize.
Absolutely. So your advice is to seek medical help, make sure that you're on your iron supplements, make sure that you're stocked on whatever products that you need, essentially changing your pads and your tampons as regularly as possible. Absolutely. Keabetswe, you mentioned that you went for uterine artery embolization. So one of our viewers says that the doctor has suggested this modality of treatment for them. What is it about? How effective is it? How does the procedure work?
Uterine fibroid embolization, usually they say they put 2 clamps in a fallopian tube. They clamp it on the fibroid, right? They clamp the fibroid, And then after the clamping the fibroid, then the fibroid will slowly die. So that's what I only know about it. Maybe you can take more charge about it.
So basically, the idea is that this fibroid is a growing mass, right?
Yeah.
So it responds to hormones. When it receives hormones, it grows. So in order for something to grow, it has blood supply that's going to it, right? So with uterine artery embolization, what you're essentially trying to do is you're trying to kill off the blood supply of this fibroid. They do it with catheterization that goes into the blood supply, and then you find those arteries, and they inject certain substances in there to try and block the arteries that are feeding this fibroid, so that the fibroids basically, it prevents the fibroid from growing rather. So it's quite an effective method. They used to think that it's problematic for people who want to fall pregnant afterwards, but research has shown that they're not so sure. It doesn't look like it affects fertility, but it's advised that if you can use another method instead of this method for somebody who still desires fertility, that would be the best way for you to go. They advise that instead. There's lots of treatment methods for fibroids. Uterine artery embolization is not the only thing that's available. Do you know of any other treatment modalities that are available for this?
I think laparoscopy, I think. I'm not sure. It's the small measure of myomectomy. The resting period will be about 2 weeks. And yeah, those are the ones that I know on my side.
Kia, do you know any methods?
No, none whatsoever.
None whatsoever. So I think that's another gap where people don't really know what's available, and sometimes people think that surgery is the only thing that you can do for fibroids. But there's a whole host of treatment modalities for fibroids. So I like to divide them into 3 different umbrellas. So the first one will be expectant management. So expectant management means we sit back and we see what happens. So that can only be done for patients who are asymptomatic. So patients who don't have the bleeding, who don't have the pain, who don't have the pain during sexual intercourse, etc. So expectant management is reserved for asymptomatic patients. And actually, the majority of patients with fibroids are actually asymptomatic. It's only the small minority that actually show up with symptoms. The 2 other umbrellas is medical management and surgical management. So medical management, there's a whole lot of drugs that we can use. There's drugs that we can give you in the acute phase. So the now, you're bleeding, you're pouring right now. We give you something to try and stop the bleeding. Then there's other medication that we can give you, hormonal treatment, where we try and regulate your menstrual cycle. We try and decrease the amount of bleeding that you see every month, etc., etc. There's other drugs that we can give you that try to shrink those fibroids and make them a lot smaller so that you can then go for operation thereafter. In terms of the surgical group, there's minimally invasive surgery, and then there's open surgery. You mentioned, Keabetswe, about laparoscopy. You mentioned that you went for myomectomy. Yeah. So myomectomy is an open procedure where we cut open and we take out the fibroids that we can see. But you can also do a closed myomectomy where you go in with cameras and then you remove those fibroids. It obviously then depends on the size of the fibroids, and how big they are. Will they be able to be removed laparoscopically? Or do we have to go in there and open you up? There's also other modalities, like you mentioned, uterine artery embolization, to see if you can try and burn the blood supply. You can also burn the actual uterus itself, the cavity. It's called uterine ablation. You can burn the cavity of the uterus. But then again, you can't fall pregnant once you've done that because you've now damaged the endometrium. So there's lots of treatments, and I think for this person asking about uterine artery embolization, my advice would be to research on it and find out, chat with your doctor and see what's the best for you. Because for somebody who wants to fall pregnant versus somebody who does not, the treatment modalities won't be the same. I don't know if you guys have heard about hysterectomies, where you remove the entire womb.
Yes. Yeah, I think I forgot to mention hysterectomy, where you literally remove the whole uterus.
Exactly. So hysterectomy, removing the whole uterus, it's not going to make sense for somebody who wants to have another child. But for somebody who has completed their family, then obviously that's now a modality that we can entertain. Absolutely. So one of our other questions was, a viewer wanted to know, how does she start to explain this to her partner? Because her partner wants to have a child, but she's got fibroids. How do we begin that conversation? So I want you guys to touch on how she can talk to her partner, and also where do men fit in the story of fibroids? Because we seem to forget men all the time.
Yeah, that's true. I think men also play a major role because it is part of the life of a family as well. I think I now can understand what our viewers been through, because I also had to have the same conversation with the father of my son, you know. And my first conversation was, I want to have a child, but I do have problems. And when you are going through that, you need to, men sometimes will go, what type of problems are you having, you know? And sometimes it is not easy for you as a woman to actually also explain. So my first suggestion would be, when you go for your gynecological appointment, go with your partner.
Absolutely.
Let your partner sit in with you. You know, I had a very supportive gynae doctor to be seen. Let my partner be in, and he explained to my partner what was happening, how the uterus looks like, what are fibroids. It does not mean that I can't fall pregnant, but I am going through this. I worked that step with my partner, and it really, really helped. He got me through that, through the procedure. He was there, you know, we eventually had a baby. So it's sitting down with your partner and taking him through those interventions with your doctor as well. It will really help her.
Absolutely. Kia, is there anything you'd like to add?
Yeah, so I think that is, you know, what Keabetswe covered is truly exactly that conversation. I think of just getting them involved is key. And I think also this is where we come in with FAASA as well, because we want to get also the awareness to the men as well. And so that's why we've got upcoming events where we want to just get them on board, which we'll also talk about. But this is really just creating awareness, not just only for the ladies, but also for the men as well. Because once they know, they're able to bring the support, you know, to their ladies, their wives, to just really bring up this, you know, beautiful unit of a family.
Absolutely. Just to echo everything you guys have said, I think we tend to forget men all the time. And it's so important, even if you're dealing with infertility issues, your partner needs to be there. It's a couple problem. It's not an individual problem. And with fibroids, intimacy can seriously be affected in that regard, because if you're constantly bleeding, you're not comfortable enough to be having sex in the first place. If you have this huge mass in your abdomen, you sometimes don't feel beautiful, you don't feel sexy. You can't even have sex with your partner. You can't fall pregnant, it's the in-laws, it's this, it's that. There's a whole host of problems that come in with, that involve men when it comes to fibroids. So it's very, very important to encourage our patients to bring the fathers in, bring the husbands, bring the boyfriends in. Let's talk about this and let's work through it together as a unit. Absolutely. You mentioned that fibroids are non-cancerous. Do you know anything about the malignant potential, or if they can become cancerous or not?
I think they are. They can get cancerous depending on, you have to go for tests, obviously. That's why for me, with my gynae, I've had my conversation with my gynae. I do know that I have fibroids, and I've made a conscious decision that every year I go for pap smear, you know, just to check myself, you know. So it's not really, I'm not a doctor or researcher to say fibroids can become cancerous, but I believe they can in a long stage. I mean, I believe if you leave something for a very long time, something bad is bound to happen.
No, I agree with you. So we call them in medical terms leiomyoma when they're benign, so when they're non-cancerous. They can become cancerous, but it's a small percentage, like 0.2% of them become cancerous. And when they're cancerous, we call them leiomyosarcoma. So we found that the cancerous ones are found more in the older population, and the presentation is a little bit different. So these fibroids are growing extremely fast, faster than the benign ones are growing. And sometimes the bleeding is quite excessive, the pain is quite excessive, etc. So again, you just need to see your doctor. He needs to take you through everything to make sure that this is something benign that we're dealing with and non-cancerous. So now you have fibroids, you have a son, you don't have a daughter, but let's imagine, let's pretend that you had a daughter. Will your daughter have fibroids? This is one of the questions that came in from our viewers. So she has fibroids and she's worried about whether this thing is in the genes, is it genetic? Do I need to worry about my daughter?
Oh, that's a tough one. I think for me, for the research that I've done,
Yes.
it can have genetics.
Absolutely.
For me, my mom never had fibroids, but my aunt had fibroids. She also suffered from having kids, you know. So I believe genetics can actually be involved. There hasn't been thorough research about it, but genetics. I believe genetics are also important there.
I absolutely agree with you. So they have found that there are some genes that are involved, but we can't say for sure that you've had fibroids and now your daughter will have fibroids. So it's something just to look out for, be on the lookout in case your daughter starts presenting with symptoms and you know that you have a history of fibroids in the family. Just be aware, visit your doctor early so that they can do a full thorough assessment and decide what's the way forward.
I think for me, another suggestion what I could give is that one of the reasons is my mother was never really part of my menstrual cycle. Parents out there, mothers, be involved in your child's menstrual cycle, especially from a young age. I started bleeding a lot when I was 16. And my mom will just say, oh, no, it's okay, it's normal.
Yeah.
But only to find out it is not normal to bleed, you know. So maybe if I could have caught them early, I wouldn't have had to go through the procedures that I had to go through. We need to be involved in our child's menstrual cycle, you know. And I find that as mothers, we don't take our kids to gynaes, you know.
Absolutely.
My first gynecological appointment was when I was 25.
That's a disaster.
You know,
it's a disaster.
You know, I had to, you know, I once told my mom that I've got thrush. And the first thing, and I was not even sexually active. The first thing she jumps, she says, were you having sex?
Oh, goodness.
And I had to, you know what I had to suffer? I had to go and clean myself with Dettol and all those things because I didn't know until a friend of mine told me, go to a gynecologist, and only to find out that it's normal to have thrush, you need medication. So we need to take our kids to gynecologists at a very young age. Not because they're sexually active, but because they need to be checked out.
You've brought up such an important topic. We know that fibroids are more common in the black population.
Yeah.
And also the black population is where all these topics are taboo. You can't talk to your parents about anything. All you need to do is go to school and come home, and that's where it ends. And I have a similar story to you where I woke up one morning in excruciating pain. I was like, I don't know what's happening. I couldn't even move out of the bed. So I just grabbed my phone and I called my mom and I was like, girl, come to my room, I'm dying. So my mother came, she was like, what's going on? I'm like, my abdomen, I don't know what's happening. So they rushed me to hospital. And when we got to the hospital, the first question the doctor will ask obviously is, are you pregnant? Are you sexually active? And my mom screamed, no, so aggressively, before I could even answer. So I was sitting there like, excuse me, ma'am, you know? Imagine the pressure now, because this doctor is trying to help me. If I say, yes, I'm sexually active, they're thinking ectopic pregnancy. It's an emergency to save my life. And this African mom is stepping in to say, no. I'm like, excuse me, can you let me, you know, can I answer the question? And so I think our parents really do they create a lot of pressure and they don't create an open space for us to communicate with them so that we can find these problems early and solve them earlier. Kia, what would you suggest? How do we start having these conversations with African parents? How do we push the boundary in that way?
Yeah, so I mean, as I've got a daughter who is 13 years of age, so quite relevant. I mean, the conversation I started having about 2 years ago, though, about everything to do with the anatomy of, you know, the vagina and, you know, what it presents. And I even gave her a book to read up, and I said, if you've got any questions, you know, come to me. But I think it's just really creating that room, that openness to say, it is normal, let's chat about what you're going through. So at least now, 2 years down the line, when she started her periods, you know, she has the freedom to now come because Absolutely. I was able to, you know what I mean, create that open door already then. And I even say, just read up, and if you've got any questions, come and let me know. But yes, I think we're coming from, and that's why for me, when I was also doing a little bit of reading, just finding out that why is it more common in the black community? Like, you know, black women suffer a lot more from this. And I mean, some research was showing, was actually highlighting the weight and all of that due to refined carbohydrates and all of that stuff, but Absolutely. It's not really, you know, for sure. And I think with more research, we're able to then, you know, make sure we narrow it to this is actually the cause, really.
Absolutely. So I think what we're saying here is that as the next generation of parents, guys, can we do better?
Absolutely.
Yes,
Can we
definitely.
show up differently in this space?
Absolutely.
There's new information that we have. We're more educated now. We're more open to learning. So can we just show up better for our children
Absolutely.
so that their children can also have an easier life and a better life?
Absolutely.
Yeah,
You can
and I
agree.
think that's where FASA also, we want to go to schools.
Oh,
we
beautiful.
want
That's
to
beautiful.
go to schools, speak about it, you know, for girls to feel free and for mothers as well to feel free that how do I touch on this topic? How do I have a safe space for my child to go to a gynecologist, you know? It shouldn't be a taboo.
Yeah.
You know,
Absolutely.
we as FASA, we want to kill the taboo of stopping to speak about it.
That's going to be a massive game changer.
Yeah.
Another question that came in often was pregnancy and fibroids. What do you guys know about that? What can you tell us about pregnancy and fibroids? What can you advise our viewers?
I think for me, on my side, it did affect my pregnancy because where the fibroids were located, they were inside the uterus. It is possible, depending on how big how small your fibroids are or how big, you know. So it is where you have to then have a conversation with your doctor. Obviously, you need to go for a scan, and the doctor needs to know where the fibroids are located. Are they inside the uterus or outside the uterus? But obviously, if they are inside the uterus, they will affect your pregnancy. So I know a friend of mine did have fibroids, but didn't affect the pregnancy. And some find out when they're pregnant that I've got fibroids when I'm pregnant, you know. So it's something that you have to have a conversation with your doctor. And obviously, we know that if you're trying to get pregnant and in a year, if nothing happens, you definitely have to see your gynecologist.
So everything that you said, they spot on. So fibroids can affect literally every step of the journey of pregnancy. So before falling pregnant, if you have a fibroid that's inside that cavity where the baby needs to implant, you might not be able to fall pregnant. You might fall pregnant, but you have recurrent miscarriages because there's this mass that's there pushing essentially this fetus out. You might fall pregnant, now you have this mass here, you have this baby, they're both trying to grow. Remember, in pregnancy, you've got lots of hormones. Estrogen is produced. Estrogen is making the fibroid grow. This baby is also trying to grow. So you might end up with a baby that's very small. We call it IUGR, basically a baby that's too small for their age. Or you have this fibroid that's overgrowing the fetus and then pushes the fetus out, miscarriage. Or you go into premature labor. During labor, when your uterus is trying to contract, that fibroid is also trying to contract, and it's basically causing issues with the contraction, so you might have difficulty in delivering. After delivery, you're also at risk of bleeding. So fibroids are quite extensive. If you're getting pregnant or you're thinking of falling pregnant, they can follow you throughout the pregnancy journey. So like you mentioned, it's very important to have a scan by your doctor. You must know that you're a high-risk pregnancy. If you see bleeding, you need to visit your doctor as soon as possible, and you need to know that those fibroids are going to grow during the pregnancy. So it's important for you to stick to your follow-ups and follow all the instructions that your doctor basically gives you. Let's go viral with our virologist, Bonolo Mashishi, with the COVID-19 news. Over to you, Bonolo.
So can a mother actually continue breastfeeding when infected with COVID? So the benefits of breast milk outweigh any associated infection with COVID. So it's still recommended that mothers breastfeed. We also do advise that mothers also get vaccinated for COVID because this allows them to protect their babies through breastfeeding. So given the fact that breast milk offers far more protection against a number of conditions, viral, diarrheal, etc., we still continue to advocate for breast milk because it's best.
Thank you so much, Bonolo Mashishi, for that valuable information on COVID-19 news. Back to our guests, ladies. We know that there are always stories that are circulating where people believe certain things that we call myths about fibroids. Can you share with us a few of the myths that you've heard?
I think on my side, what I'm finding out a lot, especially now we are on social media, you know, we'll get myths or go to Dr. Mashile or Dr. Mangmang, African doctor for healing. And then the other one would be herbs. People say take vitamin E for so long, it kills the fibroids. You know, you don't have to worry about going to a doctor. Or eating greens, you know. Now we have new diets that are, you know, Benting, that gone Benting, then you won't have fibroids.
Oh my word, insane. Kia, any myths that you've heard?
It has to do with the hysterectomy, for example, being the only, you know what I mean,
method of
procedure
treatment
that you can use for removal of fibroids, which we now know it's not the case. And also not being able at all to fall pregnant when you've got fibroids, as in it's a, you know what I mean, like it's a completely, like no chance at all. We know it does influence, like you've obviously experienced, but with regard to know, if you've got, that's it, that's the end of it.
Absolutely. So everything you ladies have said, I have the privilege of engaging with these patients who come in with fibroids, and everything you've said, I've actually heard patients saying it. Just this week, I had a patient with what you said. She literally came into us and she said she was told that she was bewitched and that's why she has these fibroids. So she needs to see a traditional healer who's essentially going to heal her from these fibroids. And she unfortunately stayed with this traditional healer for around 10 years. So she came to us at the age of 40. So you know that fertility, as you get older, you know the curve is going down. So she came to us at such a late stage. So it's important to educate the people around you, educate the people that you know. The more you know, the better that you will do. Please, guys, vitamin E, herbs, greens, Benting, all these things, please visit your doctor, you know, see your doctor so that they can come up with a plan. The sooner that you see your doctor, the sooner that we can come up with a solution for you. Even what you said about hysterectomy, some of them avoid seeing the doctor because they think the doctor's taking my womb. It's over, I'm never gonna have children. That's not true. Let's normalizing medicine. It's there to help you. So let's use the resources that are there for us. Ladies, you guys are doing exciting things. I heard that you guys have some sort of sports day or some sort of fun activities that you're arranging. Can you tell our viewers more about it and how they can get involved?
I think yes, the events director, she can actually get you through, but one of the main perspectives we are doing this events is we're trying to raise money to help at least one person, you know, and we're having a golf day, we're having a high tea, and these are happening in July. And also, I mean, after Fibroid Awareness Month, there's a following month called Women's Month.
Yes, everything belongs to us, isn't
everything belongs to us. So Women's Month will also have some events. We are going to partner up with the Stallions group, which is my running club, the group that I run with. And we'll be doing a 5 to 10 kilometer run where we'll be collecting money and speaking about fibroids. And it's open to women and men.
Yes.
And men, please
let's get the
come.
men. Bring your husbands.
I mean, that's why I'm saying golf, husbands, come. Running, men,
exactly.
come.
I love
you know,
it.
I mean, during those times, we'll be speaking. I mean, it is the event. We will be speaking about fibroids. We will be educating men as well about fibroids while we're having fun. So that's the main aspect of having these events as well. And also to help one person. These procedures are very expensive.
Yes,
as we do say that the infrastructure is a problem in South Africa, you know, there isn't a lot of public infrastructure for women to have their fibroids removed, or even if they are, the list is long. Baragwana has got like a long list of women waiting out there, you know. But only 20% of South Africans have medical aid.
Yeah.
I was fortunate. I had medical aid. I could do all those procedures. But a lot of women don't have. You look at uterine fibroid embolization costs about 100,000.
Yeah.
And you look at myomectomy costs about 50 to 60K. So we want to at least, we can make a difference to someone, you know, one woman, you know. And we also invite our sponsors out there who feel that they can speak to this brand. Please come on board with us. Come and join us. Let's make a difference to women out there.
Absolutely. Kia, our event planner, anything to add, and where can we find out more about this event?
Yes, so we've got it on our, advertised on our social media platform, so you can check us out on Instagram, FASA_org. You'll be able to see all the details there. We're also on Facebook as well. With regard to the date for the golf day, that's on the 26th of July. It's a Tuesday. And then for the high tea, that's on the 16th of July. Okay, so the other one is on the 16th, the other is on the 26th. All right, so we should be getting everybody to come in, like we're saying, to create awareness, raise funds. If we can assist, one lady at a time, for woman by woman. So this is really just there to really create more awareness, and so that we can get many ladies definitely assisted as much as possible.
Absolutely. Ladies, social media, where can we find you? The people who want to help you, the people who need help from you, where should they go?
I think our Instagram account is FASA #org, and Facebook is Fibroid Awareness Association of South Africa. So you don't write FASA because you'll find different FASAs on Facebook. So you have to write it in full. And our Twitter account is Fibroid A. So @Fibroid A. I'm not really a Twitter person, but we do have a Twitter account.
So that's where people can find you.
Yeah, and we also have a website, and our website is www.fasa.org. Yes, and we are launching, we've just launched our new brand 2 months ago. Our website is currently still under construction to the new website, so look out on that.
Absolutely. Thank you so much, ladies. And I'm Dr. Randy Lamfel. You can find me on Instagram at dr_RANDYLAMFEL. For those of you who are interested in advertising with us here at Ask Your Doctors, you can drop us an email at admin@askyourdoctors.co.za. And for those of you who want to find our doctors and our amazing guests that have been on the show, they're on our website, askyourdoctors.co.za. Ladies, it was such a pleasure hosting you today. Thank you so much for coming into studio.
Thank you for the opportunity.
Absolutely. Ladies and gentlemen, that's it from me, Randy Lamfel. It was a pleasure hosting you today. Remember to keep asking your doctors.